Good evening, everybody. Hope you can hear me. We're just about to go into our live, and let me know if you can hear me because I'm using the Bluetooth, and those can sometimes, with these Instagram lives, you tend to find that when you're using too many of these gadgets, then sometimes the network fluctuates and you may not hear everything I say. I'm going to introduce Dr. Caroline Mwendwa. I'm just going to get her to join. Then we can do our live on estrogen dominance and endometriosis. Wonderful. I can see somebody can hear me. A topic that is very close to all of us. I mean, a lot of people who actually started with me with Harriet Botanicals, I always say officially because I was doing work before that. Actually, a lot of them who have ovarian cysts, endometriosis, struggling with quite a few things and all that. Perfect. Let's see. Okay, not yet. We talk to so many women who struggle with these things. I mean, all the way from the beginning where you have excess estrogen. I mean, you have the women who don't have enough estrogen, struggling with PCOS, or all their sex hormones are converting to androgens. And then you have the women with excess estrogen, and this goes on all the way up until menopause, and then estrogen drops. And then it's like puberty in reverse. So we are waiting for Dr. Caroline. I'm just going to see if she can join. Bear with us as we work with the technology. Let's see if she can see me. Caroline, let me know. Dr. Caroline, let me know once you're in. Send her a message. Excellent. We're still waiting for. So, and many of you know that I also struggle with endometriosis like literally all my life, and I was undiagnosed for a very long time, and it affected my life quite negatively because I was in pain for a good amount of my month, my cycle, and also I didn't know what was going on in there, and I've had surgery to do with intestinal blockage when the endometriomas or the growths grow so big that they go into another part of your body and then cause problems in there. So quite a few of you understand my journey and how it led to the growth of Harriet's Botanicals, the business that we have now. And we definitely want to thank you for all the support that you've given us. I mean, we're 6 years strong. It's unbelievable. I myself, I'm shocked. Every single morning I wake up and I think, wow, we are still at it and going strong and, touching more people, and people are actually also touching us and, like bringing their issues to us and helping us solve your problems or what is like a problem for you at that particular time. And I always say pain is not your portion. A painless period is yes, I've seen your question. I use the drink, Nika. Give me a minute. I will explain what happened with that. Let me just talk to Caroline. She says she can't see it yet. Oh, perfect. I was just about. So, Dr. Caroline, can you see? Are you able to join? Let me invite you again. Yes, you're still invited. Let me cancel and re-invite you. And it says you're not able to join. Just keep trying. Great. I've just seen that you've turned on video.
Hello, hi.
Hey, How are you?
I am well, thank you.
Oh, wonderful. So I'm just going to confirm with everybody that you can see Dr. Caroline on your end. Hello, everybody. Hi, Mwendwa, I can see you. Hi, Patrick. How are you? Good to see you after, our brief meeting at Hot 96. What a great time we had. Hello, everybody. If one person on that can confirm that they can see you, perfect. I can see Naivashi Naturals. Please confirm that you can hear and see both of us, Carol and I, Caroline, Dr. Caroline, and then we can start. I just saw a yes. Thank you so much. Okay, so I was just sort of like going back the journey that we've had with Harriet's Botanicals and how we started, and the fact that I myself had endometriosis. I am endo-free now, and I'm very happy about that. And the fact that I struggled for so long, for at least 17 to 20 years. I mean, in my early 20s, in my teens, I was one of the ones in class that really struggled with this. So I'll introduce you, and then we can delve a bit deeper into the hormonal system and estrogen dominance, and then talk about endo in itself. So Dr. Caroline Mwendwa is someone I've actually known all the way since primary school. So we've known each other since I think we were both 5 or 6 years old. And we've kept in touch over the years. And Dr. Caroline Mwendwa is a functional medicine practitioner. I think something that many of you really want to find out more about. She's also a chiropractor and has established businesses in Tanzania, in Nairobi, and in Nyanyuki. And my understanding of functional medicine is that it's a holistic approach in the sense that it looks at everything. It looks predominantly at the underlying cause. In functional medicine, you don't just prescribe a pill and let the symptoms decline, because the symptoms are your messengers. The symptoms in your body are telling you what's going on with you. So literally, functional medicine digs a bit deeper. I have been through the functional medicine protocol, actually, maybe I'd say about 2 months ago, and I've actually got my results. And it's also preventative in the way it looks at the hormones at a very deep level. So sometimes you go and have this test done and that test done, but the functional medicine protocol is a little bit different. I think, Dr. Caroline, you can speak about it more. If you could just like introduce yourself and tell us a little bit more about your background, your approach, and also your practice, that would be perfect. And then we can get on with that.
Great, thank you so much for this invite. I hope everyone can hear me clearly. Yes, so as Harriet has said, my name is Dr. Caroline Mwendwa. I practice functional medicine virtual practice. I've been doing this now for about 7 years. Prior to that, I was a chiropractor for about 18 years. So my approach to health has always been very naturopathic, so to speak. And the philosophy of those lines of work is really about getting to the root cause of the problem and helping the body heal itself, as opposed to drugging the body to just suppress symptoms, but the root causes are not really addressed. So functional medicine is what we call a systems approach, which is holistic, to rebalancing issues in the body that lead to chronic illness. So I am not the doctor you want to see if you have a cold or a flu or some other acute type illness. I am the doctor you want to see if you have a chronic condition, of which endometriosis is one of those, as well as a whole host of hormonal problems that women and men can have. So today's focus is going to be on the endometriosis. And so you will be able to understand by the time we're done what the functional medicine approach to this is.
Okay, wonderful. So just reading from what we have actually put up there. So we say your goal as a functional medicine doctor includes identifying the root causes of chronic illness in each individual, so it's customized, and creating natural protocols, to address those foundational issues and accomplish long-lasting health. I just want to emphasize conditions treated include gut issues, hormonal imbalances, autoimmune disease. A lot of people ask me about autoimmune disease, cancer, and cardiometabolic conditions among both children and adults. So this is the one practitioner that says they are dealing with cancer, because people used to ask me a lot about cancer, and I kind of like shy away from something that we're not really focused on. But now you have the expert. If you want to ask about autoimmune and cancer, Dr. Caroline is here to cover those things. So wonderful. So Dr. Caroline, if you can just give us a brief overview of the sex hormones and how estrogen manifests, and then maybe we can also talk about estrogen and insulin. How some people don't even know that insulin is actually a hormone or
Yeah.
behaves like a hormone. So if we can talk about just a brief overview so people then know where we are starting from and where we're going.
Okay. So all of us, men and women, all have this endocrine system, which is inclusive of very many glands that all produce hormones. And different hormones from different glands have different functions in our bodies. Today, the focus is on our sex hormones, which include testosterone, estrogen, progesterone, broadly, okay? All of us, men and women, have all three, but women and men have different amounts of the different types. So men have predominantly testosterone and androgenic hormones. Women have predominantly estrogens, which are different types, and progesterone, which exist in a certain balance, and then exist at different levels at different stages of women's lives. All these hormones are created in our body from precursors, some of which are made by our adrenal glands. So that's another endocrine organ, which gives rise to substances like DHEA, which is important for the making of these hormones, and pregnenolone, because you cannot have these hormones without those molecules that make them up. So the brain is also involved because it has the sort of the command center that tells your ovaries, your adrenal glands, how to produce all these different hormones that your body needs and how to adapt to the changes that your body is going through as you go through life. So certain parts of the brain are very important, like your hypothalamus and then your pituitary gland, because they speak to each other and then speak to the glands directly in the body to produce these hormones. So a little bit about each of the sex hormones. Testosterone, which is known as an androgen. Androgens are generally the term referred to by the hormones that are linked to the testosterone pathway in the body. Androgens are responsible for providing women with a little bit of what they need to be able to produce, build strong muscles, strong bones, some mood modulation, and a lot of testosterone in women gets converted into estrogen. Estrogen is produced in the ovaries, as is progesterone, during the menstruation years of a woman. So through menstruation, perimenopause, there's ovaries producing estrogen and progesterone. Then in menopause, that production greatly declines. And we rely then on what our adrenal glands are producing for us, okay? Now, so these hormones have to exist in a very delicate balance. If they are thrown off, which we'll discuss the things that throw them off balance, this is where conditions like endometriosis and fibroids and adenomyosis and other problems that women deal with come from. Is one of the root causes is these imbalances in these hormones, because now they exert effects on body tissues that are abnormal, because now their levels are abnormal. Either they are too high, they are too low, or they are not existing in proper ratios to each other. So that's, I think, going to be one of the foci of this discussion, is that hormone balance situation and what impacts it, and how getting that restored is going to help you resolve endometriosis as well.
Oh, wonderful. Great. So I like what you've spoken about, like tissues, because people think about endo, we do have some people in our spaces that talk about they had endometriosis in the lungs. Others talk about how they had it in the gut. So I think it's very important for people to understand, how does you know, how does this manifest? What do you mean? Somebody else said endometriosis is like when you're bleeding into your organs. And there's even like reverse menstruation sometimes happening. So maybe we can talk about what exactly is endometriosis and, you know, possible causes, because the people who say the cause is people don't understand what causes it, and maybe the different types and the different stages.
Okay. So endometriosis, the endometrium is the inside layer lining of your uterus, okay? That tissue is very special because it has a very sensitive reaction to hormones. And so every single month of a menstruating woman's life, that endometrial tissue is going to respond to the hormonal fluctuations. And if she does not get pregnant, then that endometrial lining that was preparing to house and implant an embryo is going to shed off. And then you bleed. And that is your menstrual cycle. That bleeding is supposed to happen out of your vagina and onto your pad or whatever it is you use on your monthly menses. Now, in some women, there's something called retrograde menstruation. This is one of the causes of endometriosis, where instead of all the endometrial lining bleeding out through the vagina, some of it gets pushed back into the fallopian tubes, and then it spills out into your pelvic cavity, where those cells can now attach themselves to the wrong places in the body. So they attach themselves to the ovary, to the bowel, to the pelvic wall, on the outside of the uterus instead of being inside. So those are the most, and inside and on the fallopian tubes. So those are the most common places endometrial tissue is found. But like you said, there's some people who end up with it in the lungs. It's been found in the nose. It's been found in all kinds of different places because these are cells, they travel. They can travel in the bloodstream and plant themselves anywhere else. Now, the problem with these cells is they're very hormone sensitive. So every month, when your hormones shift to create the environment which triggers the shedding, first of all, the proliferation or increase in this lining tissue, and then the shedding of it, then you bleed. The same thing will happen wherever this tissue has planted itself. So if it's in your lungs, that tissue will swell up and it will bleed. If it's in your bowel, it will do that too. And the result of that, unfortunately, is that that blood doesn't have anywhere to go. So it's going to coagulate there and it's going to start to cause some problems. And the body tries to deal with it by having this immune response, that is inflammation, white blood cells being sent to that area to fight with this weird blood that is happening, and then damage begins to happen to those tissues. So for many women who have the endometriosis outside of the uterus, in the fallopian tubes or in the ovaries, that kind of repeated cycle eventually creates damage to where there is scar tissue and adhesions, and they find then they cannot get pregnant, or their periods become very weird and irregular. And then it's very painful because this blood has nowhere to go. This tissue is inflamed and swollen. It's going to put pressure on whatever is around it. It's going to hurt, okay? So what causes this, okay? Apart from retrograde menstruation, there are a few other causes. One of the major causes in terms of hormones is estrogen dominance. When you have too much estrogen relative to your progesterone, that is a condition called estrogen dominance. It can be a major contributor to this endometrial problem. Also, there could be genetic predisposition. Now, just because if your mother and your grandmother had endometriosis doesn't mean you have to have it, but it means you may be a little more susceptible to it than as somebody whose family didn't have it, okay? So there's a predisposition. Doesn't mean it has to reflect itself, but you may develop it more easily than someone who does not have the genetic predisposition. One area that our conventional medical doctors do not look at as a cause, but is important to look at, is a high toxic load. Women who have been exposed to a lot of toxins environmental toxins, things like exposure to certain pesticides and plastics and chemicals that really interfere with the endocrine system. They're called endocrine disruptors. That's a major cause because it interferes how their body is able to work on its normal cycle. Women who have exposure to and sensitivity to mold and have developed mycotoxins in their system will have problems in their reproductive system very often, and endometriosis is one of those things that can occur. And then if you have something like heavy metal toxicity or exposure, and that area of toxic load is an area that in conventional medicine you will never hear the medical doctor talk about or look for. Often I've seen women who I detox from those heavy toxins that they have, and their problem completely disappears because they never even knew it was there. So that's one very important thing to note as a cause. Other things that are not really causes but contributors: alcohol, caffeine, a poor diet generally is going to be a major contributor because it triggers off an inflammatory response in the body, and endometriosis is an inflammatory condition. So I think those are the major causes, and all can be addressed in different ways naturally.
So just 3 questions have already come up so that we don't lose them in the chat. The first one, someone says that they have excessive bleeding for many, many weeks. And they are asking what is the cause, because it's something I really want people to understand happens in the body. Why do I bleed excessively, especially those who have estrogen dominance? Others are asking about spotting and or even like bleeding during sex. Is this something connected to endometriosis? I think there was another question about, someone said, I have light periods, very, very light, just for 3 days. Is this normal? Is this okay? And, Daktari is here with us today. Somebody else has asked, what causes blocked tubes? And a lot of this tends to happen. People come and ask, what's going on in their bodies as we do these lives. So whichever you can answer, that would be great. And whenever you're ready to start answering questions. So maybe I can ask another question, because I know you've talked about high toxic load, endocrine disruptors, mold, microtoxins, heavy metal, alcohol, caffeine, poor diet. You've talked about genetic predisposition. You've also talked about people who have reverse periods. It goes up and fills the pelvic area. I have heard about people who have endometriosis in the brain. You talked about, the nose and the lung. So my understanding also from another doctor was that during your menses, or at the time that you would be having your menses, or now when maybe, or before, when estrogen is high, it activates endo. So if those cells have made themselves, their way to the brain, or they've made their way to the lungs, it activates. They actually are active in there. And that's part of the problem that you now have, is that they're either growing or making you uncomfortable. And thank you very much for saying that endometriosis is an inflammatory condition, like your body is inflamed. Maybe we can say a little bit more about this, because I don't think we emphasize enough inflammation, what it means. Somebody else has asked a question. I have been having unprotected sex for almost 5 months and I'm not getting pregnant. What could be the issue? So somebody else has asked, does this also cause fibroid growth and regrowth, and how can they be managed holistically? So you can see, thank you so much, Mwende, for that question. I see you. I think I saw Amina earlier on Amina Farah earlier on in the conversation. I think I saw Dr. Jonathan Awori. Thank you so much, folks, for joining and coming to support. And yes, so I hope you got my questions, my comments.
Yes,
About the
so
liver, the kidney.
the answer to most of those questions, any question to do with dysfunctional bleeding, which is bleeding too heavy, spotting at weird times, bleeding too much, cycle is too long, all these different things that come up with irregular bleeding. The issue of fibroids, the issue of, other sort of pain during sex. Yes, all those could be related, because it is at the bottom of it all, the hormonal imbalance, and most commonly, estrogen dominance. Estrogen dominance feeds a lot of these conditions in women. And when they don't understand that, then it creates a problem. So let me explain a little bit about what estrogen dominance is. Okay, we have different types of estrogens. Okay, and they break down in our body. They're produced by our ovaries, and then they break down in our body in two steps. We call one phase one, that happens in the liver, and phase two, that happens in the gut. Now, we have in our lives exposure to very many things, especially in our modern lifestyles that we live. We use certain cosmetics, we breathe certain air that is, if you live in a city, it's probably polluted, or you live near an industrial area, you're breathing in certain chemicals you don't even know about. You're eating food that's been poisoned with lots of pesticides. You don't know where it came from. It's got toxic load in it. These things, when we get them into our body, whether we're applying our lotion that has all these chemicals in it, or we're breathing bad air, or we're eating bad food, all these things create that endocrine disruption I was talking about. These external estrogen disturbances, we call them xenoestrogens. They're external estrogens that come into our system and really add to the amount of estrogen we naturally already have. This creates an overload of estrogens, good ones and bad ones, okay? Then when our body is breaking this down, first of all, our liver has to work that much harder to break it down. So our liver gets very stressed. Then our gut has to work that much harder to detox this stuff. So our gut also gets stressed. And then on top of that, some of the byproducts of this estrogen breakdown process are very toxic in and of themselves. So they put a stress in our organs, in our liver and our gut and through our bloodstream, even to our brain, and create a situation where we have symptoms, okay? How it manifests in each individual woman, what estrogen dominance will do to them is different. So I will have fibroids, the other one will have endometriosis, another one will have adenomyosis, another one will have anxiety and depression symptoms, another one will have gut problems, So everybody manifests differently, but the underlying cause may be the exact same thing, okay? So we need to break down these estrogens and remove what we call the dirty estrogens from our system, clear our body of those dirty estrogens so that the clean, healthy, safe estrogen is what our body is working with. Otherwise, we put ourselves at risk for everything and all those conditions plus cancers that are estrogen related. Okay, so we want to really look carefully at where our estrogen issue is coming from. And a lot of it is from our lifestyle and the things we eat, drink, breathe, how we sleep. So it's a holistic sort of view about what can we do about this estrogen problem. So many women with all those different things you talked about, the dysfunctional bleedings, the difficulty getting pregnant, the pain during sex, this so-called blocked tubes is definitely linked to estrogen dominance, and for many people it is endometriosis, especially blocked tubes. Could definitely be endometriosis caused.
Okay. So my understanding of like blocked tubes, and we have adhesions and scarring. So I always look at it and I say to people, I look at it like it's like a matted in there where it should be, clear. It has like almost like sticky. It gets like sticky in there with the adhesions and the block tubes and the growths and everything else, so that it prevents movement. It prevents
Yeah,
sperm connecting with egg, or once the embryo has actually been created, where will it attach? Like sometimes it is actually being crowded out by the endo. Maybe you can talk
exactly.
about what it means to have. Okay, I know we've talked about painful sex. That's a big one for some people, because people who just don't understand, why is sex painful for me. You've talked about anxiety and depression, and these are things that a lot of people really sort of like laugh at everybody else who has, oh, she has anxiety, she has depression, and they don't know that it's also hormonal related. And for me, who had endometriosis for most of my life, and it was undiagnosed, and my period was a nightmare, and the week before is a nightmare, and then the week after is just recovery. And I talk about being in this spiral, being in this like emotional, mental spiral, and being in pain also, and taking too many painkillers. So I would like to emphasize that if you have painful intercourse, we do see you, we understand what you're going through. If you have depression and it's like you don't understand why, you can also just check to see if you have endo. And more than likely, if you have been in pain for most of your life, very intense pain, the one where unaenda kudungwa shindano, I think you should check for endo, because the earlier we catch it, the easier it is to manage or alleviate. So tell us a little bit about stage 1, stage 2, stage 3, and stage 4 endo, and what that means. I just had one more question. Somebody's talking about bleeding. I think we can talk about that later. I think you've mentioned it. Yes, if you can carry on with stage 1, stage 2, stage 3, stage 4 of endometriosis.
Okay, so basically the extent of proliferation of this endometrial tissue wherever it has planted itself is
Uh-huh.
how it is staged. So when it's mild, and maybe it's not even causing you, there are some women who it's found by chance. They were not even having symptoms, but they went for another scan for some other reason, and they're told, oh, it looks like there's some endometrial tissue here, but they didn't really know it was even there. That's a stage 1 person, endo, okay? And most of the time, conventional medical treatment in somebody who is stage 1 or stage 2 is like, let's just wait and see how it goes. If it's going to remain pretty silent or if it's going to start causing havoc, okay? Stage 3 and 4 are like very severe. Stage 4 is severe debilitation. Now, it is where the endo tissue is so much, wherever it has implanted itself, there is damage. This scar tissue we're talking about and adhesions, there's severe damage to the organs to which it has attached itself, and severe dysfunction. This woman cannot function. Every time her period is about to come, she's down, okay? It interferes with your quality of life to the point where it's just like I can't deal with this pain anymore. Just do something, take out all my organs, because the pain is so
Yeah.
much, right? So that's how bad stage 4 is. Now, the thing that they do for stage 3 and 4 endo is to try and clean it up as much as they can using, first of all, the diagnosis has to be done. It does done with some scans. And then they do laparoscopy, where they put the little cameras in to your body and look around and look for this endometrial tissue. If it's in your abdomen or in your pelvis, around your ovaries or fallopian tube, outside of the uterus, they remove it. But if it has already traveled to other parts of your body, like your lungs or your brain, that's a whole other complication, right? So
Okay.
the way I tell women to think about endo is almost the way we think about cancer. It can start somewhere and then it can metastasize to other places if it's not addressed. That's the same thing with
Okay.
endo. It can start somewhere and then it can find its way to other parts of the body if it's not addressed. At that point, it becomes a systemic disease. It's not just a reproductive organ disease anymore. It's all over the body. It is causing inflammatory changes in many different places. It has systemic impact on so many organs in the body, including things like your thyroid. It can affect your brain in terms of changing how your brain works. So you actually end up with those mental health symptoms. It puts you in a situation where you're at risk of developing diabetes. You can have cardiovascular problems because it changes how you metabolize cholesterol. So you start building cholesterol in your arteries. You have issues with nutrition because women who bleed a lot or have heavy menses, that time of the month, they drain a lot of iron and magnesium and zinc. So they have deficiencies. So they're just, and the pain centers in the brain are actually amplified. So pain perception is actually increased. And you can just have so much dysfunction at that stage 3 and 4 level. So the best thing, like you said, is to diagnose it early so that it is caught at the earlier stages. I feel like the wait and see approach is not good enough at that stage. We need to do something in order to help the body recover, right? Yeah.
Okay, okay. So tell us a bit more about what can we do? I mean, you know, at Harriet Botanicals, obviously, we have the products that we are using, natural, holistic, you know, alternative medicine that we are using to manage hormones, to help you evacuate it through the liver and through the gut. And we have products for insulin resistance, and we also have supplementary products, supplements that help get the nutrition back into you, so to speak. And we also have dietary products that support, because people say to me, oh, you know, I've got estrogen dominance. I literally can't eat anything. I can't have dairy. I can't have meat. I can't have red meat. I can't have alcohol. I can't have coffee. I can't have gluten. You know, I can't have sugar. You know, like, what is this? So we always say it does take time and intention to sort of like create an anti-inflammatory supportive diet for your condition. Maybe you can talk about what we can do. You know, we only have like maybe another 10 minutes, and if you have any more questions, please post them on there. And this live will actually be saved, and you can actually follow Dr. Caroline Mwendwa. You know, she's on Instagram, and from there you can get more information. So tell us a little bit more about, now we're on like on the happy side. We talked about the sad side, Endo. Now let's talk about the
Yeah.
happy side. What can we do?
Okay, so things to do, and I hope everyone has a pen or somewhere they can write down the things they can do.
Yeah.
So if good job. The first thing you need to do is to look at your diet, okay? Estrogen dominance and its consequences, including endometriosis, are inflammatory conditions, like we have already said. So adopting an anti-inflammatory lifestyle includes an anti-inflammatory diet. So that diet should include organic, whole food that is nutrient rich. I always tell people to think about eating the colors of the rainbow on their plate. So it means you eat a lot of plant food that is different colors, purples and browns and reds and yellows. And if you have different things on your plate of different colors, you're getting a ton of good nutrients and enzymes that are going to support the healing process in your body because they are anti-inflammatory naturally. The more you can get of these things raw, the better, because cooking tends to destroy some of them, right? So try and do that as much as you possibly can. We must make sure that we have a good bowel movement every day. Preferably 2 or 3 in a day would be best. Because if you're not evacuating your bowels regularly, that is where some of these estrogens and things are removed. If they sit in your gut, it's not being evacuated, they get reabsorbed and recycled back into your system, adding to the estrogen dominance problems. So making sure you have enough fiber in your diet to ensure that you have good bowel movement daily is very important. Fluid, obviously, water is very important. Otherwise, you will not be able to have a good bowel movement either. And you want to keep your body well hydrated so that all your organs are working as well as they can. Observe one more thing with diet. To improve that digestive process, Harriet's Botanicals has some really good digestive products that will help keep you regular, help with the digestion, and provide some enzymes. If you do not have access immediately to those things, you can also use, very simple, some lemon water. Hot water with some lemon in it before you eat, 15 minutes, is going to activate your own digestive enzymes. Or apple cider vinegar is going to activate your own digestive enzymes or digestive bitters. Anybody has heard of those? They make your digestive process work better so that all these estrogens can be detoxed through your gut as well. The other thing is to maintain a good microbiome in your gut, because these bacteria that live inside us that are called the microbiome, there is a special category of them. We call it the estrobolome, whose job is to help us process these estrogens. If your microbiome is unbalanced, this estrobolome is not doing its job, you will become estrogen dominant. So decent probiotics, which can come from food, fermented foods, okay? We are in Africa, we like to do our mala, we like to have, different fermented products that we can drink or eat that can help us keep our probiotic levels in our gut in good working order. So dietary-wise, that's one of the things you need to do.
Okay.
The next,
Can I just, 2 questions before you, so that you can just have in mind what people are asking. Can pregnancy through IVF be successful with stage 3 endometriosis? That's one question that's come through. One more. If you don't have a myomectomy, can fibroids kill you? Because these things will be the end of me. Somebody has said that. So at least we also want to talk about the possibility of pregnancy with surgery, IVF, IUI, or everything else. Maybe you can also talk about that.
Generally, with endo, if you want to get pregnant, they usually recommend doing that laparoscopy to clean it up first, so that you don't have so much endometrial tissue just hanging about and creating havoc every month. Now, the problem with the laparoscopic approach is that they come back. So there are women who had endo, who went and had the laparoscopy done. The endometrial tissue was cleared. They successfully got pregnant, either naturally or via IVF. They managed. They had their baby. They were fine for a few months after baby was born. Then when their regular hormone cycle began to kick in again, the estrogen dominance was back. So guess what came back too? Okay. So we need to, so if that woman does not do the things to address this these foundational things, then she may get pregnant, but she may then still have problems thereafter, okay, with some interventions that are done. The other interventions that are used are severe. So there are women who had hysterectomies, where the hysterectomy then didn't actually solve the problem because the endo tissue is in other places, right? So you will still have some symptoms despite having had a hysterectomy. It also depends on what kind of hysterectomy you have. Then there are women who have been put into medically induced menopause in order to just stop the cycles altogether, which comes with its own inherent risks long term. Because the earlier you go into menopause, the more likely you have to have other complications like osteoporosis and heart disease and other things that kick in earlier in life. And they're all pretty dangerous. So we would like to see women employ all the natural, holistic things they can prior to ending up in major surgeries like those, or using extreme measures like stopping their periods entirely through medical menopause. The other thing I want women to know that they need to do, which I think you mentioned early on, Harriet, was the importance of blood sugar balance. And this is where the insulin comes into play. So that diet that I talked about, that is so important, that should be organic, whole foods, needs to be also, it's anti-inflammatory, but it also needs to be blood sugar balancing, okay? It is very important that insulin and blood sugar are kept in good balance, because they have an intrinsic interaction with our sex hormones. So some conditions like PCOS, for instance, where women have excessive testosterone, which, by the way, most women who have PCOS are also estrogen dominant, because that testosterone gets converted to estrogen at some point. It's just too much, yeah?
Okay.
So women with PCOS, for example, are going to struggle with what we call metabolic syndrome or insulin resistance. What does this mean? Your body requires every single cell requires some sugar to make energy, okay? Sugar is not just the sugar you add to your tea, but the sugar that comes from breaking down of the foods you eat. So when you eat a potato, or you eat a sweet potato, or you eat an apple, it all turns into sugar in your bloodstream, okay? And that sugar is used to, it enters the cell and it is then used to produce energy for you to carry on your everyday activities and for your metabolism to keep running. If you have insulin resistance, the insulin your pancreas is producing that usually carries this sugar knocks on the door of the cell opens the door and allows it in. That mechanism is not working anymore, not working well. So the sugar, the insulin is knocking on the door of the cell and the cell has refused to recognize it. So it's not opening the door. So the sugar is remaining in the blood. Okay, that is what's called insulin resistance. Your cells have become insensitive to the insulin that's present. So what does your pancreas do? It starts producing more and more insulin, trying to activate the insulin receptors on the cells to force them to open. And the more insulin is produced, excess insulin in the bloodstream has a lot of detrimental effects. And then you also have excess sugar in the bloodstream. So that's the pinnacle of what insulin resistance is. And people who remain in an insulin resistant state eventually will end up as diabetics because now the pancreas has been pumping out all this insulin for a period of time. The cells that are responsible for doing that are going to poop out. They will not be able to do it effectively anymore. So then it crashes and it can't produce enough insulin. So people end up on insulin injections because now the pancreas is not doing what it should do, okay? So the first treatment they do is try to make your cells more sensitive to insulin. So some of these dawas like metformin, etc., that's their purpose. Glucophage, you'll see people are taking that to try and make the cells more sensitive to the insulin. But when you stop taking those drugs, you're back to square one. So we need to figure out naturally, how do we help our insulin resistance? And that can happen a lot with lifestyle, and it can happen a lot with your diet, with your exercise, with your sleep habits, and with supporting your liver, because a lot of these things all have to be processed by your liver. So we want you to do what you can to balance blood sugar. And we have products for that at Harriet's Botanicals, as well as other places, okay?
Yes.
The last
Okay.
thing I think I would talk about,
Okay.
a do, yeah? Something women should do is try to detoxify their spaces. Stop buying Nivea and I don't know, these body washes and, you know, the chemical-based products. Go for natural body care products. Go back to your natural soaps that do not have added perfumes and chemicals in them. Look for natural oils like the coconut oil or the shea oil, butter, you know, use those rather than the manufactured lotions and things. Go back to as much of natural use of products as you can to reduce the load of xenoestrogens you're putting into your body. In your home, try and replace all this plastic stuff that you store your food in with healthier stainless steel or glass storage containers. Get rid of these pans that are coated with this non-stick stuff. That non-stick stuff is really awful. It's an endocrine disruptor as well. And just use a normal stainless steel pan rather than the non-stick coated pan. So try and shift your products away from the chemical-based stuff into natural stuff around you. So those are things you can actually do. Yeah.
I always tell people that women that to make sure that whatever is in your shampoo or your body wash, whatever is going, because remember the skin is like the largest organ, it just absorbs. So just read those ingredients and find out what they are. Because we are moving, if you can go into any shop now and they'll tell you these are natural ingredients. They have no parabens or no phthalates or no this. So you have to just become very aware. You know, you might pick up like the cheapest body lotion, but take a look at what's inside it. That's the first thing, is just be aware that yes, I like this body lotion, I like this perfume, but it has this thing that may not be so good for me, increasing sort of like the dirty estrogens, and then take a look at your kitchen, find out what you can change. Because I think sometimes for people who have these conditions, it's always a bit of a shock to be told to change your home, change your diet, change the containers, change your clothes, change what's going on with your hair. Hair is a big one, especially for Black women, because we're putting all sorts of conditioners in there. We're perming our hair, we're chomaring it, we're blow drying it. And you could be in a salon where they're not very conscious of the ingredients that are being used. And there has been a link, especially with perms and curly kits. There's been, some people say there are studies that are linking these to the excess estrogen that is manifesting, particularly in Black women. In Europe, I know they say fibroids are actually a Black women's disease. And I think, well, the only reason can be because of our products. What else would make us so susceptible? So thank you so much for that. I know there was one more question about, if you don't have a myectomy, can fibroids kill you? So I think maybe you can answer that. Well, give a reasonable answer to that,
Yes, fibroids are benign tumors. They're not supposed to kill you, but they can be so draining by just sucking they create a blood supply to themselves, and they're greedy because they want to grow. So they suck you dry. And so women who have many fibroids or very large fibroids will be very drained. They'll be anemic all the time because all their blood supply is being eaten up by this thing. Plus, not to mention the physical discomforts that they cause. Women have back pain, they have pelvic pain, they have abdominal pain, they have now this heavy bleeding that is just really excessive when their period comes because the fibroid is just so large and therefore it's shedding a lot of blood. So it won't kill you outright, as in I'm just going to die, but you can actually feel like you are because of how badly it's draining. Exactly.
Okay.
So
Okay.
fibroids are a bit tricky, just like endometriosis, in the sense that they need the root causes need to be addressed, but there's a stage where having them surgically removed is probably a good idea so that you can have some level of quality of life. But please address the root causes or they will come back, as long as you're still menstruating, it's a possibility. As you move towards perimenopause and into menopause, they tend to start shrinking and eventually they calcify. They lose their blood supply and they just become like a little rock in your pelvis. In fact, when we x-ray women who've had fibroids in the past and didn't have any surgery, we will see little pebbles, as if they look like little pebbles on the x-ray. They're just calcified and they sit there and they're inert and they're doing nothing. Yeah.
Okay, because I know somebody just asked, what happens when the fibroids are already calcified and I'm not menopausal? So maybe this is when we talk about the estrogen drop that starts happening around age 40. Maybe you can say something to that and just say last word, and then we can wrap up, and that's it.
Okay. Yeah. So when we get to our 40s, we start to have this shift, a decline in both estrogen and progesterone. But sometimes the rate is not equal. We tend to lose progesterone faster than we lose estrogen. And estrogen is so potent that when we have it at a higher level, or the ratio of estrogen to progesterone is not quite balanced, then we will experience symptoms of estrogen dominance. So even as you approach menopause, as your hormones are dropping, you still might be estrogen dominant, not because you have a lot of estrogen, but because you have very little progesterone. So that relative deficiency of progesterone is what's giving you estrogen dominant symptoms. So as we approach menopause and fibroids are shrinking and menstruation is becoming more scattered and whatever, the symptoms, other symptoms that you never had before may show up because the estrogen is still significantly higher than the progesterone at that stage in life. I think one final thing I want to say before we wrap up is specifically for endometriosis. We've talked about general things to do for estrogen dominance, but specifically for endometriosis, a few things you can do. Add some natural proteolytic enzymes like serrapeptase Serrapeptase is one of the enzymes that has been studied to be able to help dissolve some of this endo tissue, okay? Add mushrooms, medicinal mushrooms, like reishi and shiitake mushrooms. They are immune modulators, and they really, really help with the inflammatory response involved with this, together with vitamin D, magnesium, and phosphorus, because those are so important in how this hormonal process is working. Reduce stress, because when stress kicks off, your adrenal glands go off and all your hormones go off, okay? Add curcumin. Curcumin comes from turmeric. Add that into your daily routine because you want to reduce inflammation. It's a very potent anti-inflammatory. People use evening primrose oil for female-related issues. It is a very good omega-6 called gamma-linoleic acid, but borage seed oil has more gamma-linoleic acid than evening primrose oil. So maybe look for borage oil. Use castor oil packs over your pelvis and uterus to draw out through your skin. You see how we put things into our body through our skin? We can also draw them out through our skin by sweating, through our exercise, sitting in a good infrared sauna. We will be able to detox that way, and using castor oil packs to draw out the toxins from your body. And use herbs. The herbs that are made by Harriet's Botanicals, arrowroot, mosipchot, for the men, tendwet, and I think you have a host of other things that will help with digestion and hormone balance that women can learn about from your pages. Use those herbs. You can add others that are available to you from places like Healthy You and other places that help with regulating hormones like chasteberry or vitex, something called blue vervain. They're available to you. If you have a lot of pain with your endometriosis, serrapeptase will help, but also something called dong kai is going to be very helpful. It's a Chinese herb. Ginger is great, and magnesium when you have the pain as well and the spasms of your uterus, so you can do that as well. And lastly, I just want to encourage women to take a Dutch test. This is the dried urine test for comprehensive hormones. It is a test like you haven't seen before. I think Harriet can maybe tell you about that another time and let you understand, because she's gone through it and she knows that this test gives them a level of detail about how your hormones are being broken down that allows you to then understand for your individual problem how you should address it and where the interventions should be. And I think that is where I can be helpful.
Okay, wonderful. Thank you so much. There's two other questions. Now that you talk of plastics, is Tupperware safe? And what I'd like to say about plastics is that you also have pharmaceutical grade plastic. And I think most people are talking about the microplastics. So you would just need to sort of like look at your Tupperware and where it's from and what the manufacturer is saying about it. How do you deal with mustache and beard growth in ladies and white hair at an early age? I always say white hair is a symbol of wisdom. The mustache and beard growth is usually symptomatic of PCOS, which we talk about in another live. You've mentioned some things that I might want to repeat. Some other herbs that are available like chasteberry, vitex, blue vervain, and seraptes for pain. You also talked about ginger and magnesium, and then the Dutch test, which we'll probably cover in another session. But you talked about the castor oil packs. So there are so many things you can do out there. 2024, in 2024, women are taking control of their health, which means that we are saying no to pain and no to inflammation, and yes to well-being, yes to peace, yes to prosperity, yes to happiness. And so that is like the ethos of who we are at Harriet Botanicals. We're really here just to support your wellness. You can use our products or you can use other products. We do recommend other products, and we are actually stocked in Healthy You, so that you can go in there and get our products and other products or other products. And I just want to say thank you so much, Dr. Caroline. This has been illuminating, even for me. I feel like I'm always learning. I mean, there's something new every single day, something good out there that can also help me. I can try the castor oil packs, which I actually have not. But if you wish to contact Dr. Caroline, just follow her on IG. You'll find the details actually underneath the post where we advertise. And we've been, we really would like to bring you at least one live every month with different practitioners talking about different things. But for now, Asante Sana, Dr. Caroline. Thank you, everybody, for joining. And we sign off here. Thank you.
Thank you, Harriet. Thank you very much for having me.